All right, let's get right to it. Think of this less as an explainer and more as a mission briefing. Your mission to solve the silent epidemic raging in the Kibo Highlands. 847. I want you to really let that number sink in. That's how many mothers died last year in just this one region. And the worst part? Every single one of those deaths could have been prevented. Each one leaves a family absolutely shattered.
And that's why we're here. Because these aren't just numbers on a chart. They were real people, casualties of a system that just couldn't get to them in time. Your job is to figure out how to make sure this tragedy doesn't happen again.
So, let's get down to business. Your mission is to change this reality. You've been deployed, in a sense, to the Kibo Highlands. Let's get you briefed on the operational environment, what you're walking into.
Okay, so here's your area of operations. We're talking about 2.1 million people, but they're scattered all across these remote mountain villages. The terrain? That's your first huge obstacle. The roads are unpaved, and when the rainy season hits, for 4 months a year, they're basically impassable. Imagine needing to get to a hospital. On a good day, it's a 3-hour journey. And calling for help? Good luck. Mobile connectivity is only at 12%. It's a luxury most people just don't have.
And this right here, is the absolute core of the crisis. In the Highlands, the maternal mortality rate is 612 deaths for every 100,000 births. Now look at the national average, it's 412. That gap is just staggering. It tells you that right now, your geography can be a death sentence.
Okay, so we've got the numbers. But to really solve this, you have to go deeper. We need to look at the human factors. We have to understand the people, why they make the choices they do, and frankly, what they're afraid of.
Now, this is a really critical piece of intel. Look at where women are actually giving birth. 60%, a huge majority, are attended by what are called traditional birth attendants, or TBAs. These are people the community knows and trusts. Only 40% are giving birth in a formal health facility. So what's going on here? Why is that? Well, here's your answer, and it's not just about how far away the hospital is. It's about dignity. Surveys with patient advocates show there's a deep, deep mistrust of the formal health system. Women say they feel dismissed, that their concerns are ignored, that they're not respected. So what do? They choose to stay home, surrounded by people they actually trust. Okay, so all of this brings us to the decision point. Your decision. You've got limited resources to tackle a really complex problem. You can't do everything at once. You have to choose a strategy, and there are basically 4 distinct paths you can go down. Okay, path 1, you could fortify facilities. Pour your money into the hospitals and clinics. Recruit more skilled midwives. Basically, build a system that people will actually want to come to. Or path 2, empower communities. You could work with those 200 TBAs that everyone already trusts. Give them training, give them modern tools. Path 3 is all about tech. Leapfrog with technology. Use things like drones to get around those bad roads. Use telemedicine to bring in expertise from afar. And then there's path 4, the integrate and balance approach. You try to do a little bit of everything. It's comprehensive, sure, but you risk spreading your resources way too thin. And just to make it interesting, here are your constraints. You've got $2.5 million, and you have just 12 months to show results. The clock is absolutely ticking. Now, no matter which strategy you pick, the good news is you're not starting from zero. You'll have a toolkit of proven, life-saving innovations at your disposal. Think of these as your weapons in this fight. First things first, you have to know your primary enemy. It's called postpartum hemorrhage, or PPH. It's severe bleeding after childbirth, and it is the #1 killer of mothers in these highlands. It happens fast, it's incredibly deadly, but, and this is key, it is preventable. So check this out. This is a simple but incredibly powerful tool. On the left, you see the old way. Basically, just guessing how much blood a new mother has lost. On the right, something called a PPH-calibrated drape. It's just a low-cost plastic sheet, but it lets you accurately measure blood loss. This simple little thing lets anyone, even a traditional attendant, spot a hemorrhage early. And the data is clear. It can slash cases of severe PPH by 60%. Okay, so that's a low-tech solution. What about high-tech? I want you to remember this number, 51%. So what is that? That's the reduction in maternal deaths from hemorrhage they saw in parts of Rwanda after they started using medical drones. Think about it. When a mother is bleeding out, a drone can deliver blood products in minutes. It turns what would be a fatal journey into a survivable event. This tech has a proven track record. It saves lives by making geography irrelevant. But you know what they say, no plan survives contact with reality.
You can have the best strategy, the most amazing tools, and then something totally unexpected happens.
I mean, you can map out a perfect plan, right? Launch in month 1, get your community health workers trained by month 3, distribute all your supplies by month 6. It looks fantastic on paper.
And then, this happens. A crisis alert. A massive landslide, thanks to heavy rains, has completely wiped out the main road into the highlands. Just like that, your perfect plan is obsolete.
The consequences are immediate and they are dire. 3 villages completely cut off. We're talking over 4,000 people totally isolated. And among them, 17 women who are in the final stages of pregnancy. To make matters worse, their local clinic has only a 4-day supply of emergency medicine left. So, what do you do now?
And this is where we get to the real heart of the matter. Because the decision you have to make, it goes so much deeper than just logistics or technology. You have to understand the people of the Kibo Highlands, they've seen this movie before. Well-intentioned outsiders show up with big plans and big promises. They start a program, and then they leave. And the program fails. The community is left with nothing but broken promises. So the biggest obstacle you're facing, it isn't the roads, it's not the budget, it's the profound lack of trust.
And that leads us to the final, fundamental question you have to answer. What is the real problem you're here to solve? Is it a technical problem, something you can fix with drones and better medical supplies? Or is it a human problem, a relationship problem that can only be solved by building trust, one person, one conversation at a time? Your entire strategy and the lives of hundreds of mothers and babies next year, it all depends on how you answer that question.